Meantime, this discussion about fluoride that we brought up before the last break. In Florida today, Governor DeSantis signed a bill banning fluoride from the drinking water. So this has become a big issue. He's following the lead from Utah. And tomorrow, the state's first of its kind ban goes into effect there. So, of course, a big thing for Robert F. Kennedy Jr., the Health and Human Services Secretary. He's advocated for removing fluoride from drinking water, claiming it's associated with some illnesses. We've heard, on the other hand, from some medical associations, CDC and others, saying it's useful, helps to prevent, for example, tooth decay. Here with us now, with some perspective, is Dr. F. Perry Wilson, who's an associate professor of medicine at Yale. Dr. Wilson, welcome. What is your perspective on this? We've done a few segments on it since it has come up. What should we know?
Yeah, it's not amenable to a short soundbite, but I'll tell you that the benefits of fluoridation of the water supply have been very clear for decades. They clearly reduce the risk of cavities and improve dental health in the population. What we're not as clear about is the potential harm. So we have very strong evidence for benefit. We have sort of equivocal evidence for harm, which comes from some unreliable sources. And it seems to me like we're throwing away, decades of a successful public health intervention without great evidence to support that decision. And some kids are going to get harmed from that.
That's interesting. So it is, I get it, to your point, it's more nuanced. And even though it might be not amenable to a soundbite, I will still play one from Secretary Kennedy just to get his argument out there in part. And then you can react to that. But it seems like you're saying, well, part of it's right and part of it's not. But anyway, here's what Kennedy, part of what he said recently.
I want to point out that in August, the National Toxicity Program, which was an arm of the NIH, did a meta-review of all the science on fluoride and found that there's a direct inverse correlation between fluoride exposure and low IQ in children. So the more you get, the stupider you are.
Okay, that's provocative, I guess. More fluoride, lower your IQ. So what would you say to a comment like that?
Well, so there's a couple of things there. For one, he associates it with low IQ. In fact, if you look even at the study that he's referencing, it combines data from many studies, many of which I will say occurred outside of the United States, in places where the fluoride level from natural groundwater is many-fold higher than what you see in the United States. But what it finds was that at levels that are 2 to 3 times fluoridation we see here, the difference in IQ might be 1 IQ point between people that were exposed to that much and people that weren't. Now, to put some context in there, if we really want to focus on children's IQ, the randomized trials that looked at Head Start programs, so early childhood education before kindergarten, improved IQ scores by about 9 to 10 points in children. So there are lots of things we can do. Early nutritional programs increase IQ in children. So I would love to have our kids get as much of a benefit in terms of their intelligence as they can. It seems to me like fluoride here is doing a lot of work for, again, a benefit that's quite unclear.
Okay, well explained on your end. We appreciate it. Dr. Wilson, Dr. F. Perry Wilson from Yale. Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.